Hi, welcome to You and Your Health. I'm your host, David Bertone. Today's show is dedicated to a specific injury to the knee that has become more commonplace in terms of injuries to athletes and non-athletes. We're talking about the anterior cruciate ligament of the knee, better known as the ACL. We're finding that as athletes get a little bit more advanced in their sports and non-athletes in their chosen field of work, with certain traumatic events can develop a tear of this very important stabilizing ligament. As advances in technology and surgical skills have progressed, along with more evidence in terms of the rehabilitation process, we're able to get the athlete and the non-athlete back to their chosen sport or work much faster. We're lucky to have today one of the legends in the area of orthopedic surgeon. Dr. Harry Bade has been practicing over 30 years and specializes in the area of anterior cruciate ligament surgery. He is the founder of Professional Orthopaedic Associates with offices in Tinton Falls, Toms River, and Freehold. Dr. Bade, welcome to the show.
Thank you.
All right, we're going to talk about the ACL today, and it's in the news quite often with various athletes. I'm sure you've seen hundreds, if not thousands, of athletes over the years with this type of injury. Tell us a little bit about your background and the type of surgeries and athletes that you see that may have this particular problem.
Well, as you have said, I am an orthopedic surgeon. An orthopedic surgeon specializes in the musculoskeletal system. Early on in my training, being an athlete, I became interested in specializing in sports-related injuries. I was lucky enough to train at the Roosevelt Hospital in New York, where Dr. Parks, James Parks, was the Met physician. Also, Dr. Patterson was the physician for the Rangers and the Knicks. Mm-hmm. So immediately as I started in my clinical practice, being an intern and resident, I am dealing with sports-related injuries. Later I went to the hospital for special surgery. There we were involved with the USGA tennis, but also the New York Giants. And I was involved with Russell Warren, mm-hmm. who is the team physician for the Giants.
Great.
And that's it's continued. I'm still sort of a consultant. I will see people that are related to the Giant family. Mm-hmm. I do not see the athletes. They go still to Dr. Warren. Mm-hmm. But with that, when I came to New Jersey, as you said, 30 years ago, I started my practice and I started to be more involved in sports-related injuries. Mr. Walt Reeser, who is the athletic trainer and the athletic director at Rumson Fairhaven, called me during my first year of practice, and I went over and met him, and that's when it sort of all started. I started to be the physician for Rumson Fairhaven, and over the years, my practice of 7 other orthopedic surgeons that are also all dealing with sports-related injuries have sort of accumulated about 20 of the high schools in the area, right, where we go to all the football games and we sort of hold clinics for them. I'm also the team physician for Monmouth University, for Georgian Court University, and I have been for the USBL, which is the Professional Basketball League, and the Jersey Stallions.
Great.
So, again, I'm an orthopedic surgeon, but we specialize the practice. All of us specialize in sports-type injuries.